In this lab, we'll be taking a look at range of motion. Let's begin by looking at flexion and extension. We can see that flexion and extension are movements in the anterior posterior plane. What that means is the body part will either move forward or backward, right? So the movement is going to be forward and backward. Flexion, we're going to see when you look at the joint, the angle of the joint is going to decrease between the two bones that make up the joint, right? So we have here it decreases the angle between the articulating bones. Now extension is the exact opposite. Extension increases the angle between the articulating bones, right, which are the bones of the joint. And then there's a type of extension called hyperextension, which moves the body part past the anatomical position. So let's take a look at the picture of the from our book. Let's look at flexion and extension of the head first. So here the lady is standing straight up, and she's in the anatomical position. When she flexes her head or neck, she brings her head forward. If you notice, the angle right here has gone from being open to close, right? When she bends her head down, she's decreased, right? She's made that angle smaller. So that would be flexion. But now when she brings her head back up, that would be extension, right? So they're showing you the arrow here. So bringing the head forward is flexion. Bringing the head back up would be extension. Now, if she goes backwards, beyond the normal range, beyond the normal anatomical position, this is what this book is calling hyperextension. Hyper meaning an increased extension. The elbow. Here she has the elbow straight, right? When she flexes the elbow, she's going to make this angle smaller right here. See how it got smaller? So that would be flexion. But then when she straightens the elbow back out, that's going to be extension, right? So doing like a bicep curl, that's what it looks like over here. This would be flexion of the elbow, and then when we do a tricep, we would extend it this way. Okay, so extension increases the angle of the joint. The hip joint. So here we have the hip joint. You can see it's straight right now in the anatomical position. When she brings her thigh or her leg totally forward, her whole lower limb forward, this is going to be flexion, right? So what we're doing is we're decreasing this angle right over here. When we bring the thigh back again, this would be extension. Right? So this motion right here, flexion, would be bringing the thigh forward. Extension would bring it back to the normal anatomical position. And then if she brings it backwards, this would be hyperextension. A lot of people just call this movement backwards extension also. Our book calls it hyperextension. But notice all of the body parts moving are forward and backward. Right here they're showing you the wrist. Right, when we bend the wrist, making the angle of the joint smaller, that would be flexion. And then when we bring it back, say it would be straight down, that would be extension. And then bringing it beyond backwards, that would be hyperextension. The next two ranges of motions are abduction and adduction. You can see they sound the same. So I like to say abduction and adduction. This way it sounds a little bit different. So abduction and adduction are movements in the frontal plane, meaning that the movement is going to be side to side. So abduction is movement away from the longitudinal axis. You could think of the body for the most part, movement away, where adduction is movement toward the longitudinal axis or the body. So let's see what we mean by that. So now we have an anterior view of the woman. She's in the anatomical position. Let's start with the shoulder joint for a second. So you can see when she's in the anatomical position, the arm is just kind of hanging straight down. When she does abduction, notice she brings the arm away from the side outwards, right? So we're moving the body part away and we're moving in the frontal plane. When she does adduction, she's bringing the limb back closer to her body, right? We're adding it back to the body. Hip joint, same thing. When she's in the anatomical position, it's just hanging straight. Then as she goes away, all the way out this far, that's abduction. And then when she brings it back, this would be adding it back to the body, adduction. We can abduct the wrist. So again, just kind of taking the wrist and bringing it out away from the body is abduction. Sometimes they call that radial deviation. And then when we bring it back towards the body, that would be adduction. We sometimes call that ulnar deviation. All right, so that's abduction and adduction. Here's the fingers, same thing. We're spreading the fingers apart, right, kind of from the midline here. They're moving apart. That would be abduction. And then when we bring the fingers back towards the midline, the middle finger kind of being the midline, that would be adduction. Now, if we kind of marry together flexion and extension, abduction and adduction, we end up getting a circular kind of motion. And only joints that can do flexion and extension and abduction and adduction can do this. This is called circumduction. So if you take a look here, the shoulder can flex and extend, and it can do abduction and adduction. And this woman here, you can see, is actually kind of drawing a circle with her arm, going in a circular motion like this, and that would be called circumduction. You can do that with the wrist. If you just kind of take your wrist and just kind of make your hand go in a circle, that would be circumduction. The next motions we want to look at are rotational movements. So we can just rotate the spine, and that's simply turning the spine to either the left or the right. All right, so if you have an individual look to the left or look to the right, that would be rotation of the cervical spine. And if somebody kind of twisted their low back a little bit to the left or to the right, that would be rotation of the lumbar spine. When the limb rotates, right, the upper limb or the lower limb, the term we use are the terms we should say are medial rotation, sometimes called internal rotation, or lateral rotation, sometimes called external rotation. Medial rotation is where we're turning the limb inward. We're actually going to rotate the limb in, and lateral rotation is where we're going to rotate the limb out. Let's take a look. So here we're giving the example of spine movement first. Right, here's the individual's neck. When she turns her head to the left or she turns her head to the right, that would just be rotation of the spine. Here, she's rotating her humerus. So when she turns the humerus in, that would be medial rotation, also known as internal rotation, or she rotates the limb out, that will be lateral rotation. Same thing, the femur. If we were to take the femur and turn it in, medial rotation. If we took the femur and turned it out, lateral rotation. Another rotational movement is the forearm rotating. These two terms are going to be pronation and supination. Let's do pronation first. This rotates the forearm so that the radius rolls across the ulna. It is the forearm that's moving. What we can use as a reference point, however, is the palm, and you'll see that the palm will either face down or posteriorly, depending on how you're standing. If you're in the anatomical position, it'll face posteriorly. If you kind of had your arm on your desk, you just kind of turn so your palm is down. That's pronation. Supination is the exact opposite. That's going to turn the palm up. Right, so the radius is going to roll so that the palm is up. So we can see over here, when the palm is turned down here, the forearm rolls in such a way that would be pronation. When the palm is up, that would be supination, right? You could think of holding like a cup of soup, or when somebody lays on their back, their face up, supine. When somebody's laying face down, they're prone. All right, so here again too, you can see the pronation and supination, but notice, guys, it's a rotation of the forearm. We're just looking at the palm as a reference point. Okay? Pronation and supination. So let's take a look at some special types of movements. The first two are inversion and eversion. Here we're going to use the sole of the foot as a reference point. So if you turn the soles of your feet so they face in, that would be inversion. If you took the soles of your feet so they face out, that would be eversion. And you can see here, right? So taking the soles of the feet, facing it inwards, and taking the sole of the foot and kind of flaring it out, that would be eversion, right? So inversion here, eversion here. Dorsiflexion and plantar flexion. So dorsiflexion is actually flexion of the ankle because we're actually making the angle of the joint smaller. This would be equivalent to you if you were driving your car and you took your foot off the gas pedal, right? So you're kind of lifting the ankle up. Plantar flexion is if you were putting your foot down onto the gas pedal, pushing down. So you're kind of planting your toes down. This would be plantar flexion. All right, so here's a nice good picture of this. We're looking at a side view of the ankle. So we bring the foot up like off the gas pedal, dorsiflexion. Right, we could also call it flexion of the ankle because this joint got smaller. Or if we point our toes down, this would be plantar flexion, right? Like planting your toes down. Or we could call it extension of the ankle because we made the angle bigger. Most people say dorsiflexion and plantar flexion. Here's a special movement that occurs in the hand. Opposition. This is if you took your thumb and kind of rotated it towards the palm or your other fingers. Maybe you actually touched your pinky to your thumb, your ring finger, right? Your fourth finger to the thumb, the middle finger, the third finger to the thumb. That would be opposition. And then when you go and separate the fingers again, just go back to normal anatomical position, that would be reposition. So here you can see this woman is opposing her thumb to her fifth digit. She could do the thumb to the fourth digit. She could do the thumb to the third digit, and the same thing. You could do opposition to your pointer finger to the second digit. But just bringing it back would be reposition. Protraction and retraction. So this is a movement. This kind of reminds me of this. If you went to your dresser and you took your top drawer and you just kind of pulled out the top drawer towards you and then pushed the drawer back in, it's that kind of motion, kind of moving something just forward and backward, right, on a horizontal plane. When we move a structure anterior, right, forward, we call that protraction. When we move a structure backwards, that would be retraction. The two bones that really move in protraction and retraction are the mandible and the scapula, right? The mandible and the scapula. Those are typically what we can protract and retract. So here we can see if she takes her jaw and just kind of pushes it forward, that would be protraction, and then bringing it backwards would be retraction. Right? If you took your shoulder blades and just kind of brought them back together, retraction, bring your shoulder blades forward toward your chest, that would be protraction. Depression and elevation. So depression is if we move a structure downward, or if we pull a structure upward would be elevation. So here they're doing the mandible. Right here she's depressing the mandible by dropping the jaw down. Here she's taking the mandible and bringing it back up. If you did the scapula, right? If you did a shoulder shrug, if you just kind of bring your shoulders up, that would be elevation of the scapula. If you bring your shoulder blades back down, depression. And so those are scapula. We use elevation and depression. The mandible. Those are two of the bones we typically do that also. Use those terms also. Lateral flexion is just side bending. This refers to the spine. So if you would just tilt your head to the left, or just kind of tilt your head to the right, or your lumbar spine to the right, and then your lumbar spine to the left, the motion you would be doing is called lateral flexion. Right, so here we can see she's bending her head to the right and left. Right here you would document, right, the patient could do, 30 degrees of right lateral flexion, but only 20 degrees of left lateral flexion. Let's say there was an injury or something like that. You would have to specify which way the individual's moving. And the same thing too, I didn't say it before, but when that you document rotation of the spine, you want to say which way the individual is having maybe difficulty, turning. So turning the head to the left or turning the head to the right would be decreased, or it could be normal.